also doing the similar presentation to the faculty. So she's doing that. I'm doing this one. But if we need to, we can call her into this meeting as well. But we're here on behalf of the Student Health and Wellness Center for the student fee. We did a public forum last Monday, and we'll be doing another public forum again this following Monday for anybody who's interested in learning more about what we're trying to do. But as we had discussed in the past and as approved by the student government is the allocation for increasing the student health fee. And in that way, Ms. Collier, who is our acting director of the Student Health Center, and myself, we are asking for the support of the student government to still move forward with the student health fee increase. We've provided a little bit more information for you, as well as some compromise solutions, and we're always willing to take feedback. So as we'll go through, hopefully. Okay, the presentation is on your committee's website too, so if you need to, you can always fall back to it and get more information. But this is the mission of the Student Health Center. If you can imagine, we're here to provide success for our students' health and wellness. Our current services that we have, you know, the mental health services, the medical health. We're currently now pushing into telehealth services, and we do a lot of community referrals. We do a lot of family planning for students. We have over-the-counter medications. We do health fairs, and then we do a lot of medical and crisis aids here on the campus. Our staff in the office is myself as the director. I came on board as the overarching director last August. We have a department assistant. We have an acting director of the Student Health Center, medical assistant, college nurse, 4 student employees, and 2 licensed marriage and family therapists. And we also have 2 interns within them, but they're not actually hired by BC. They're helping out. Just to give you a little bit of an overview of our student population, currently we're at 37,000 students enrolled for this academic year of 18-19 is what we're looking at. That's the last year. That was the year that we have compliant. This graph kind of shows you that we have been increasing from year to year to year. Our clinic visits have also increased drastically from year to year to year. We almost have about a third of the population come visit our services. For these clinic services are actual one-on-one. They're not the services that we do like our drives or anything in that matter. These are one-on-ones. Here's a little bit about our revenue that we have been receiving. Each student pays a student health fee for it. As you can see, after 2016-17, the student fees revenue started to decrease, but our enrollment increased. And we'll go a little bit more into why that's happening. So just kind of giving you the numbers of how it is between the fiscal years that we have, the head counts that have gone, the clinic visits that are there, and the difference between it. Since 17-18 and 18-19, our services have grown almost 27%, 26-27%, while our revenue has decreased about 4% that year as well. So some of the national data that's telling us, if you can see, we've looked at, we're part of the NCHA survey, and they produced that. Over 30% reported a health issue, deferred their academic success in the past year. You know, especially when we're looking at what's happening right now with the pandemic, we've been doing a lot more mental health services, a lot more group services, to making sure that students feel that they are supported in their way. How the state of California, through the California Community College's Chancellor's office, they have stated that they would, there's a cap on student fees, and that cap for the student health fee was increased to $21 for the semester and $18 for the summer. Currently, oh, this is reversed, my apologies. Currently at BC, my apologies. Currently at BC, this is what our fees are, is 13. I don't know why, my highlighter is not working. My apologies on that, but these two are split. Currently at BC, we're $13 for the fall, $13 for the spring, $10 for the summer. What the cap is by the Chancellor's office is $21 for the fall, $21 for the spring, $18 for the summer. Kind of what the Chancellor's office says about the student fee is pulled directly from their legal opinion for it, and it's just basically saying that students should be able to pay into a student health fee whether or not they use the fee, because overall the fee does help all students in general, and every student should be utilizing the services of the student health fee. We're asked a lot these days by students for more telehealth services, and we're at the brink of what teleservices we can have with the amount of funding that we are given and we're expected to use. So basically, what is our request? Basically, it's to support the health and wellness of all our students at Bakersfield College by slightly increasing our student health fee. As I mentioned, the cap of the thing, the allowable is 21. We're currently at 13. What we're proposing is $18 for the fall and spring semester, $13 for the summer. This is an annual increase of $13 for the school, for each student annually. As you can see in this thing, we're asking for a $5 increase for fall and spring and a $3 increase for the summer. With the elections that came in, we understood that students' budgets are tight, and so we're not going to that full-fledged where we probably need to go. We're going to meet students halfway and say we'll just go 18, 18, and 13, which will help a lot in one way or the other. So in that increase, what are we looking at doing more? We're doing it more online screenings. We're doing more Cognito online training. This is for faculty and staff to learn how do you review, how do you work with students, how do you, the first responder kind of a thing, how do you engage students in various conversations, community resources, our magazine, the one-on-one health, podcast videos, more immunizations, the flu shots, over-counters, TB tests and screenings. Many of our allied health services and education programs rely on us to provide them with their tuberculosis testing and screening. We do a lot of labs and we do a lot of referrals to the community. Consultations, our teletherapy has increased drastically. Individual offices, access to different services. We'd like to increase all these services. We're very minimal in these services right now. We need to increase this, especially as our population is growing, especially the type of students that we're serving. Our rural students that we're serving, they need access to health services. So who does this affect? It affects all services provided by the California Education Code, but it also exempts these following students in the student health fee. And so these are the 5 precautions that are exempted from giving the student health fee. So I've done a little bit of a projection for you. This is an FY19. That's kind of what we are sharing right now. Can people hear me?
Yes.
Okay, I just got a text message saying that they lost me, so wanted to make sure. So the student health projection budget is it is a very estimated kind of portion. So right now our revenues for FY19 through the student health fee was about $495,000. This is on the estimate of $36 per student annually. We're having about 13,800 students over the head count for it. This is kind of our projection. The actual realities of what we sold. We actually went into a deficit of $36,000 that year. So with the new increase going from $36 annually to $49 annually, Cindy and I, Ms. Collier and myself, are looking into some strategic methods and partnerships with the community and trying to figure out how we can use a lot more telehealth services and engage in more conversations that way. So we're starting to go to different companies in the community to really help our student health center be there. And with the increase that we're looking at to 680, we're looking at about 2,500 carryover. Granted, there's going to be a lot more expenses that are going to come up that we don't know about. Right now, we can say that I don't have budgeted in here for masks. If we are to come back to campus in the fall, we would want to provide our students with masks. We would provide the students with masks, and that's kind of where that carryover will go over to and going into the negative. Just like how we had to provide hand sanitizing stations and stuff like that this year, that's kind of why we went into the negative. Other things have happened as well, but that just gives you an overview. Also on your communities workshop, I kind of put a quick fact sheets up there, some pros and con arguments that were provided to me through some of the open forums that we held this semester. Why are we asking for this change now? We need to fund our student health center. Our student health and wellness center is solely funded on the student health fees. Medical services and personnel costs continue to rise. The demand for medical and mental health services are increasing. Our student fee has not increased since 2006, and everything else has started increasing. So it's about time that we need to go out for an increase for it. Our revenues are decreasing while our enrollments are increasing, especially within our special populations. The need to expand our services to telehealth is needed. Mental health funds are year to year, and they cannot rely on that as a stable source of us. And we just need to continue our excellent medical and mental health services to all our students, especially in this time that we're looking at. We want to continue all our free services that we have. We want to continue adding more free to low costs, referrals, prescriptions, physicals, stuff in that matter. Why do we do this? Mainly for the health, wellness, and social issues negatively impacting, delaying, or halting our California community college system students. Academic progress is our #1 thing, and health and wellness is truly what we need to do. So the student health and wellness contributes to our student success. And at this time, I'll turn it back over to Vice President Escobar as we do. Thank you.